Introduction to the lymphatic system. The lymphatic system, it is a whole nother system of vessels. And the lymphatic vessels are very much like veins, except they're even thinner and floppier. And the four functions of the lymphatic system, okay? One, it is supposed to return all of the extra interstitial fluid to the blood. So the blood that gets pushed out of the capillary and into the tissue space is called interstitial fluid. And not all of that interstitial fluid gets pulled back in to the capillary. Some of it stays there and it starts to build up and build up and build up, and you start to get swollen. You get like edema. So one of the jobs of the lymphatic system is in the evening or at night when you're asleep, resting 6 hours or more. The lymphatic system is picking up all that extra interstitial fluid and taking it back to the blood. But on its way back to the blood vessels, okay, it has to travel through these lymph nodes. And the lymph nodes clean the lymph. Okay, so what is lymph? When this fluid is in the blood, is referred to as blood or plasma. And then when the fluid gets pushed out of the capillary and into the tissue space, it is referred to as interstitial fluid. But when it gets picked up by the lymphatic vessel and it's within the lymphatic vessel, then it's called lymph. But it's all the same fluid. All of it is the same fluid. It just depends on where it's located, what is it called. Okay, so if it's in the blood vessel, it's plasma. If it's in the tissue space, interstitial fluid. If it's in the lymphatic vessel, lymph. Okay, while the spleen doesn't clean the lymph, it actually filters blood and cleans the blood. Now, what does it mean, clean the lymph, clean the blood? So the lymph nodes and the spleen, they trap any bacteria or viruses or cancer cells or poisons or anything that really it shouldn't be in the blood. It gets trapped by the lymph node and the spleen, and then those will imprisonate, keep them captive and try to destroy them. So if you're destroying bacteria and viruses, then that helps to fight infection. So that is another function of the lymphatic system. Since it's removing these harmful agents, bacteria and viruses from the lymph and from the blood, it helps fight infection. And so this is why if you do have an infection, a nearby lymph node might be swollen because it is busy fighting infection. It is busy trapping those bacteria and trying to kill them all. So they will get swollen. Okay, so this is one of the functions of lymphatic system. And a fourth function is to pick up chyle and take it to the blood. Chyle is fat-laden lymph. So when we digest our food, it gets absorbed from the intestines and goes into the blood, and then it goes to the liver to be processed. And that is true for everything except for fat. So fat gets picked up by these little lymphatic vessels, lymphatic capillaries, does not go to the liver, and it gets taken to the blood, directly to the blood instead of going to the liver. Everything else, though, all your other nutrients goes to the liver to be processed. Okay, so 4 functions in the lymphatic system. That's going to be a test question. The lymph nodes all over the body are named according to their location. So here in the region of the neck, the cervical region, these are going to be the cervical lymph nodes. And in the armpit, those are going to be your axillary lymph nodes. And here in the inguinal region, those are in the inguinal region, so they're in the inguinal lymph nodes. So for this test, I want you to know the names of those 3 areas. But, you know, just for example, you have like submandibular, this is your auricle, so preauricular, postauricular, they're all named according to where they are located. Okay, so this is just like for example. For the lymphatic vessels that are located throughout all this yellow vessels here, this is my lymphatic man model, and throughout your whole body you have these yellow, well, they are the vessels, lymphatic vessels throughout your entire body, very much like veins. But for the first test, and they're also named according to where they're located, just like everything else. But this right here, this is a major lymphatic duct right here, is called the thoracic duct. So I do want you to know that one, the name of that lymphatic vessel for the first test. So let's pause the video and name those structures real quick. Oh, I didn't point out this guy. Do you happen to know what is the organ number 6? I didn't point him out. But that one is the spleen. The spleen is going to be right next to your stomach. It is kind of behind the stomach and protected by the ribs. We have 3 pairs of tonsils. These are part of the lymphatic system. And the job of the tonsil is just like a lymph node, really. It's to trap bacteria, viruses, poisons, hazardous agents that we do not want to, we trap them. We don't want them to continue to go somewhere else in the body. So this tonsil right here is referred to the nasopharyngeal tonsil. So this is your nasal cavity. This is the pharynx. Pharynx is throat. But behind the nose, it is the nasopharynx. So this is why it is called the nasopharyngeal tonsil, because that's where it's located, in the nasopharynx. So nasopharyngeal tonsil is also known as adenoid tonsil, okay? Adenoids, or the adenoids. Now this tonsil is trying to protect the middle ear from infections. So it is sitting at the opening to the eustachian tube. The eustachian tube is the tube that goes from the nasopharynx to your middle ear. And this is like, have you ever like popped your ears? Like if you're like go deep diving in the deep part of the swimming pool and you come back up and you're like, I can't hear. Or like if you're on an airplane and it kind of feels like you got closed ears, you just hold your nose and blow and it pops open your ears. So that is putting the air pressure to open up your eustachian tube. So the eustachian tube goes from the nasopharynx to the middle ear. Now if the bacteria travel up, you know, that you get from your nasopharynx full of bacteria, if the bacteria travel up the eustachian tube and you have fluid in your middle ear, then they're going to have this big party, like a swimming pool party, like, ooh, fluid, woo, bacteria, and then you're going to get a middle ear infection, otitis media. So the adenoids are there, and really they are trying to protect you from middle ear infections. And then we have the Palatine Tonsil right here, which is the one that if you like stick out your tongue and say, ah, you can see them back there on the sides. And their job is to help protect you from getting a sore throat. So your throat, again, is referred to as your pharynx. And so if it were to be inflamed or infected, this is called pharyngitis. Commonly referred to as a sore throat, but or a throat infection, but in anatomy and physiology, it is pharyngitis. Then we have the lingual tonsils. Lingual tonsils are right here before entering the larynx, which is going to take air to your lungs. So the lingual tonsils are going to be trying to trap bacteria and destroying these bad guys before entering this respiratory tract, and it's going to help prevent respiratory tract infections. So, have you ever heard of anybody having their tonsils removed? And so, oh, I had to get my my tonsils removed, my adenoids removed. Okay, so there's a couple reasons why they might be doing that. So we already know that the purpose is to protect you from infection. But sometimes you'll have people that have this recurring otitis media, like just middle ear infection, and then they go to the doctor, they're like, yep, you got a middle ear infection, here's to take some antibiotics. They go home, they get better, they take their antibiotics, it gets better, but then in a month or 2 months they get it again. They go to the doctor, like got to get middle ear otitis media again, and then they give them the antibiotic and it works, but then they get it again. So if you have, like in the file, that you had more than 3 otitis media infections in a year, that's recurrent otitis media. Like you kept getting it and we kept treating it, but it kept coming back. So at that point, they think that maybe the adenoids are actually the source of the infection, because the adenoid is trapping these bacteria, but if they're not removing them, the bacteria escape and move up the eustachian tube to the middle ear. So then they start to think that maybe the adenoid is actually the source of the infection. Now, I don't believe you're supposed to remove those adenoids until after the age of 2, and this is because some babies, lots of babies, maybe all babies, that eustachian tube does not quite fully develop, fully open until they're maybe 2 years old. So they may just be having otitis media, recurrent otitis media, because the eustachian tube is like always closed. And so there's fluid that builds up in that middle ear, and it just keeps getting infected. Like they have what's called eustachian tube dysfunction. It's because the eustachian tube is not open. It's just always closed. So that was kind of the case with my daughter. She had her adenoids removed, but it wasn't until she was like 4. So let's talk about the other reason why you might have your adenoids removed, which is the case of my daughter. She did not have, well, she did have a lot of otitis media when she was a baby, you know, little toddler. But the reason that her adenoids were removed was not because of a recurrent otitis media, but because it was actually interfering with her ability to breathe when she was asleep, because they were so big. You see this passageway right here. So when you're asleep, this muscles relax, and it just kind of closes. It just kind of closes off this nasopharynx. And those, especially if those adenoids are really big, it just completely closes off this nasopharynx, so they have a hard time breathing. So she has to breathe with her mouth open, and she would snore. And so they said, you know what, it might help if we take these adenoids out. You don't need them. You know, she's already 4. And also they like went in here and like shaved off some concha to open up the passageway, because everything was like super small, and it really did, it helped her. Like she wasn't snoring anymore, and she could breathe better. And so that's another reason you might have your tonsils removed. Just kind of open up this air passageway, especially at night when you're asleep, because these muscles just relax and it kind of closes. Now, why would somebody have their Palatine tonsils removed? Why would they have a tonsillectomy? This is called an adenectomy, and this one's a tonsillectomy. Why would you have your palatine tonsils removed? Because of a recurrent pharyngitis. So if you keep having like the same throat infection, like let's say strep throat, and then you go to the doctor, like you have strep throat, you get an antibiotic, and this keeps going on, and then you get better, and then you have this strep throat, you take antibiotic, you get better, and it's like more than 3 a year. It's like, okay, maybe the tonsil is actually the source of the infection. That could be true. So they just take this off. They just scoop it out. They have a sharp little spoon that's like a razor blade, and they just scoop it out like that. This one's even easier. They just go through this external nares here, and they just scoop it out. But this one, when they scoop out the palatine tonsil, it leaves a little open hole. So what they started doing is leaving a little bit of the tonsil there so that it doesn't leave that open hole that is very easily it gets infected, and then it's like doesn't close because it's always infected. So they said, okay, you know what, there's too much complications removing the entire tonsil, so we'll just leave a little piece of it and see what happens. And it was less complication, but some of those people, their tonsils grow back. They get the tonsil coming back. But really and truly, when you read about tonsils, they're more important during your childhood when you do not quite have the most developed immune system. So they say they're not as important when you are an adult. So the books may say that. The palatine tonsils, those are the ones at the back of the throat that you can actually see them, okay? And lingual tonsils behind the tongue, you can't see them. You can't see this should say nasopharyngeal tonsil. You can't see that, but that's where they would be located. They're like up there in the nasopharynx. So these are some healthy palatine tonsils. They're really big. These are big. You're like, whoa, you have really big palatine tonsils. This is more like you can hardly even see them, but there they are right there. More healthy, also healthy palatine tonsil. But here's somebody who's got that white pus. That is infection. Okay, white pus indicates that dead bacteria. So that means that there's these white blood cells that are trying to fight infection. It's not dead bacteria. They're dead white blood cells. Correction. Pus is dead white blood cells. The reason they're dead is because they're eating bacteria. So the bacteria are also dead. So there's a bacterial infection, and the white blood cells, the monocytes, the macrophages are eating these bacteria and destroying them, but then they die. So pus is dead white blood cells that are eating bacteria. So it indicates a bacterial infection. This person maybe has definitely some kind of bacterial throat infection back there, and they need an antibiotic. I would say this was strep throat if they were like bright red and like on fire. Look like they're on fire. The thymus. Let's go back real quick. If it's just doesn't have the pus, but it's really, really red and inflamed, that you don't know that's bacterial infection. It could be viral infection. If it's a viral infection, antibiotic is not going to help. So when you see the pus, that's kind of like the go ahead, give them antibiotic. But if you don't see the pus, it just could be a viral infection, and viruses, they have this life cycle is like 24 hours, 48 hours, 72 hours. So it may just be 3 days and they're going to be better. So you don't need to take an antibiotic when it's not bacterial. It's just a virus. Now, after the 3 days, if they still have this throat infection, you go back, you look in there, they should have pus if it's bacterial. But if it's not, I mean, so in other words, you don't give them an antibiotic until after like 3 days. Unless you see the pus, then it's like, go ahead, give them an antibiotic. Okay, the thymus. You are born with a thymus. You absolutely have to have a thymus. It's considered a vital organ. It is going to set up your immune system. It makes those original antibody producing cells, the cells that can respond to antigens, foreign antigens, make antibodies to attack and destroy foreign antigens. This is your immune system, setting up your immune system. The thymus is a vital organ because it sets up your immune system. If you're born without a thymus, you will not have an immune system. You can't fight even a common cold, and you will die. So this is why it is considered vital. However, by the time you're 18 or 19 years old, you no longer have a thymus. It kind of disintegrates, or it just kind of gets reabsorbed by the body, or it turns into like fatty tissue. So you just really need it to develop the immune system, and then once you have those antibody producing cells, then you don't need the thymus anymore. So it just kind of disappears. It's sitting right there on your heart, and then it disappears. The spleen. The spleen is over here, protected by your rib cage. It is kind of like toward the back. It's behind your stomach. It's on the left. On your left side. This is the liver, this is the pancreas, and there's that spleen. So the stomach would be right here. The stomach would be sitting right here. There's the spleen. And the spleen, it filters your blood, and it removes bacteria and viruses, and it like cleans out the blood. So if you do have an infection somewhere in your body, like let's say the appendix, or maybe your peritoneum is infected, or even you have like gastritis, or some kind of intestinal infection, it is highly probable that the spleen will be inflamed, like swollen, because it is busy. Like a lymph node gets swollen, when you have a sore throat, these cervical lymph nodes a lot of times will get swollen because they are trapping bacteria close by that are trying to escape and cause infection elsewhere. So the spleen is kind of like just a big lymph node. And if you have an infection somewhere in this abdominal area, somewhere in here, that spleen is likely to become swollen, just like a swollen lymph node. Now, another thing about the spleen, which is right here, what was this? What was this organ? The pancreas. Another thing about the spleen, something interesting. It also stores red blood cells and platelets, just in case you need them. In case you have like a hemorrhage or a sudden hemolysis or something, the spleen can like release out some extra stored red blood cells and platelets. But also, just so you know, it's not the only organ that does that. The liver also does that. Okay, so right here, there's 2 slides that you need to review. Okay, so you're going to pause the video, and then you're going to answer these questions. Again, pause the video and name the structures X, Y, and Z. And that is the lymphatic system.